Are you noticing fine lines and crepey skin around your eyes? You are definitely not alone, and today we're going to dive into why that happens and, more importantly, what you can do to refresh and firm your under eye area. I'm Dr. Sam Ellis, and I'm a board-certified dermatologist in Northern California, and I'm here to help you understand your skin and find products as well as procedures that will work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. So under eye crepiness is a really common problem that bothers a lot of people, and inevitably in my cosmetic consultations, it's something that comes up. It may not be the thing that brings the patient in for their cosmetic consultation. For example, they might be more worried about brown spots and deeper wrinkles and folds, but inevitably we end up talking about the under eye area as well because it does start to show those signs of aging much sooner than anywhere else on the face. And people can have a lot of different issues going on with their under eyes. They might be bothered by dark circles or bags, but crepey skin happens to basically everyone, and it's just that very delicate, fine wrinkling, like what you see in crepe paper. And how you address under eye crepiness is kind of different than how you address other under eye problems, which is why I wanted to dedicate a video to it. And it often needs a combination of topical skincare as well as in-office procedures for the ultimate improvement. And that's what we're gonna review today, what you can be doing at home and what you could do in the office to optimize that under eye skin. The reason we start to see changes in that under eye area sooner than other parts of the face is because that skin is really thin. It has less collagen, it has less elastin, it has fewer oil glands, so any tiny decreases or shifts in the amount of collagen or elastin are going to be more obvious. And I think of crepey skin kind of like the tip of the iceberg because it's showing those early signs of aging of the under eye, but as that skin thins out, you then can see all the other structures that exist under the eye, like the fat pad and the blood vessels that exist there, and that's when you start seeing things like an under eye bag or dark circles. Now, aside from just getting older, because of course we're going to see these changes as time goes on, there are definitely other factors that influence the skin quality of your under eye. Genetics are going to play a role. Of course, your day-to-day lifestyle also makes a big difference. Like how much sun exposure do you get on that under eye skin? What kind of sleep do you get? And also, and I think this is majorly discounted, but how much are you manipulating that under eye area? For example, people with eczema or those who have seasonal allergies where their eyes get itchy tend to rub that eye skin a lot. And what I can tell you is that skin does not do well with chronic friction. Think about a callus that forms on your hand or your foot from repeated rubbing. The same thing can essentially happen to your under eye area, but that's not the type of skin thickening we want. The reason for that is when you rub the skin, it almost creates like a defense mechanism and it causes something called epidermal hyperplasia, which is essentially the thickening of the very top layer of your skin. And the thickening of the top layer of the skin actually leads to the appearance of more lines and wrinkles. When we are talking about optimal, ideal thickening of the skin, we actually want the dermis, so the deeper areas of the skin, to be plumping up, not the top layers. And aside from lifestyle, environmental, and genetic things that tend to negatively impact the under eye skin, this other fun thing that happens to women as we go through menopause is you get this drop in estrogen, and estrogen makes the skin supple, and when you have a drop in it, it causes crepey skin everywhere on the body, including the under eyes. So with all that being said, let's talk about what you can actually do to improve the quality of your under eye skin. And I'm really honing in on the quality of your under eye skin because when that skin is more firm, all the other problems that we see under the eyes like bags and dark circles and hollowness also look better. So one thing I always talk about with my patients is getting their allergies under control. A lot of people don't realize how much they are rubbing or manipulating the skin around their eyes. So if they have itchy or watery eyes and they're not on a daily antihistamine like Zyrtec, for example, I do recommend that. When you have allergies, you're not just itching and scratching the under eye area, but you also can get a little bit of congestion of the blood vessels under the eyes, which makes dark circles worse. So often when people start on an antihistamine, their under eye starts to look better for a variety of reasons. Now, if you don't have allergies, you also want to make sure you're not rubbing your eyes for other reasons. So sometimes when I'm watching someone on TikTok or on a YouTube video take their eye makeup off, I am appalled. The way people go at their under eyes and scrub, or take a really rough washcloth and just like ram it into their eye area. Please don't do that. Even though that's just a brief moment in your skincare routine, that kind of intense rubbing can really do damage to that delicate under eye skin. No matter what eye makeup remover you're using, apply it to your eyes and then let it sit there for 10 to 20 seconds and start to break down your makeup. That way, when you go in with your fingertips or a cotton pad, it's gonna slide off much more readily and you're gonna get away with a lot less friction. Before I get into what to put on your eyes and how to take care of your eye skin at home, I do wanna say that the eye skin is really sensitive. And I'm talking about like getting irritated, but also for like allergic reactions, for example. Things that might not bother other areas of your face can cause a rash or irritation on your eyelids, so you need to be really careful with what you're putting on there. And it's not uncommon as you get older to develop sensitivities to certain things that you used to be able to tolerate on your eyes. So your eyelids are like your first indicator that something is wrong in your skincare routine and you need to make an adjustment if you're having redness or irritation there. Aside from not rubbing your under eyes, I cannot stress enough how important it is to protect your eye skin from the sun. There are a variety of ways you can protect your eye skin from the sun. Number one, of course, is bringing your sunscreen up around your eyes if you can tolerate that. There will be some people where no matter what sunscreen they're using around the eyes, it causes irritation or stinging, and in those cases, we start relying on things like sunglasses and hats to physically protect that area. Now, aside from using sun protection to actually protect your skin from UV radiation and the damage that that causes to the skin, the other reason it's important to protect your eyes from the sun is so you're not squinting so much. I see this all the time when I'm out in public, like at the park with my son. I'll look out at the other parents and they're squinting at their kid on the slide, or they're like looking directly into the sun and they have no protection on. It's these small choices that build up over your lifetime and lead to the aging changes that we don't like to see in our 40s, 50s, 60s, and beyond. So doing those little lifestyle interventions like wearing a wide brim hat or wearing your sunglasses when you're outside and it's sunny can be really helpful. I literally never feel guilty when I buy myself a new hat or a pair of sunglasses. I'm like, this is more than just a fashion statement. Now, I always bring whatever sunscreen I'm applying to my face up under my eyes, but there are additional under eye SPF products that I do like. So for example, the brand Dermatologist creates this pigmented under eye cream that has SPF 41, and that's just another way to add protection to that area. Plus, it's color correcting, so it's gonna help with the appearance of dark circles and it's gonna brighten that area up. Now, anything that's in the makeup category, people are usually not slathering on, so you do still wanna have a layer of separate sunscreen on there, but I like these color cosmetics that have sunscreen in them because it's just another way to be mindful about how you're protecting different areas on your face. The other thing is if you feel like the sunscreen under your eyes either causes your eyes to water or it causes your makeup to transfer, use a makeup setting powder under your eyes to kind of set down your sunscreen. That's gonna prevent it from creasing and prevent it from bothering your eyes. I think this is also a good time for us to talk about eye creams. We cannot do a Crepey under eye skin video without talking about them. Under eye creams are not miracles, they are not magic wands. There is not one secret under eye cream or ingredient that's going to solve all your under eye problems. Especially because a lot of under eye problems that bother people, like bags and dark circles, are really due to anatomical or deep structural problems. It's not even really due to the overlying skin. As a dermatologist, I definitely think you can get away with not using a dedicated eye cream. That doesn't mean that I don't use one because I think it just gives me a step in my routine to really focus on that area, but I feel like some of that could just be placebo effect. That being said, if you have an eye cream that you absolutely love or swear by, let us know in the comments. Rather than thinking about a specific under eye cream, we really want to think about what kinds of ingredients can benefit the skin under the eyes. So for example, retinoids like retinol or even prescription tretinoin. These are vitamin A derived topicals that help thicken the skin, improve cell turnover, help with fine lines and wrinkles everywhere on the face, including the under eyes. But the downside of retinoids is they can be quite irritating and not everyone can tolerate them under the eyes. They also can have some negative impacts on the oil glands around the eyes. So for people who are prone to dry eye, I don't recommend putting a retinoid near your eyes. I know I talked about the brand Dermatologist earlier when I was talking about their little sunscreen product that goes under the eyes, but they also have a really nice eye cream that has a very gentle retinoid in it. So that could be good if you like the idea of using a retinoid under your eyes, you don't have sensitive eyes, but maybe you can't tolerate your stronger products there. It also has peptides in it, which help promote collagen production. The other thing you can think about doing if your under eyes are really sensitive is applying your moisturizer first under your eyes or even your non-retinoid eye cream and then layering the normal facial retinoid that you use up under your eyes, and the moisturizer underneath it will kind of act as a buffer. Now, retinoids are not the only thing that help with fine lines and wrinkles and collagen production under the eyes. I also am always looking to peptides to fill that role. A lot of eye creams are starting to incorporate peptides now, and if you use a peptide serum for your face, you could always bring it up under your eyes. A specific peptide under eye product that I really like and is really affordable is by Coco Kind. I think it's actually a pretty new launch for them, but what I like about it is it not only has some anti-aging peptides in it, but it also has a lot of ceramides, which are going to help strengthen and fortify and support the skin barrier so that area around your eyes looks better but also feels good. A lot of people also don't realize that alpha hydroxy acids, like glycolic acid, also help stimulate collagen. So if you're ever doing like a peel pad or a topical exfoliant to your face, bring it up under your eyes. Now, when you are doing this, always stay over the bone. You never want to go inside the eye socket. That is way too close to your eyeball. And that really goes for any eye creams or products that you are putting around the eyes. My other little tip is if you're using a hydration serum as part of your skincare routine, make sure you're bringing it up under your eyes. Hydration serums contain humectants, which are things that draw water to the skin's surface, so that's going to have an immediate plumping effect wherever you put it. I remember when my brand Prequel launched Multi-Quench, which is our plumping hydration serum, so many people DM'd me about putting it up under their eyes and how much it helped the appearance there. And I just have one more product recommendation for under the eyes. Of course, you don't need to be doing all of these things. You have to figure out kind of what works for you and what works in your routine. But for people who have really sensitive under eyes or who find that they are allergic to a lot of things in common skincare, I totally recommend the derm-founded brand Vetted. The whole premise of the Vetted skincare line is to create skincare that doesn't have a lot of the common allergens for people who do have sensitive skin. So I recommend just getting their thicker, richer moisturizer. I think it's called M2, and you can apply it everywhere on your face. But if you want to use it as an eye cream that you're likely able to tolerate, highly recommend. I also want to talk about an eye product or category of eye products that you've probably seen if you consume any type of anti-aging content on TikTok, which are the creams where people apply them under the eyes and then immediately, over the course of 2 to 5 minutes, their under eye bags and crepiness instantly disappear. For example, the Peter Thomas Roth Instant Firm Eye Cream, it went viral for this. The way these instant under eye products work is as they dry, the molecules in the product create a little net or a film that brings the skin together and tightens it. The problem with these is that as soon as you add water to that, for example, a water-based makeup or anything in your skincare that's water-based, it breaks that netting apart and you lose the effect. So it's really good if you want to wear it on its own, but you have to understand that that effect is completely temporary and it's not making any long-term changes to the quality of your under eye skin. And then lastly, when it comes to topical skincare under the eyes, I sort of alluded to earlier that women as they age lose estrogen and that can lead to crepiness under the eyes. Well, you can actually apply topical estrogen there to help plump that skin up a bit. Topical estrogen is not something that you can buy over the counter. You have to have it prescribed to you, and I have plenty of other videos that talk about topical estrogen if you have more questions. But just know it's something in your anti-aging arsenal, and it's particularly effective for the under eye area because that skin is so thin and responsive to estrogen. So those are all the things you could be doing at home. You can do some of them, you can do all of them. Essentially, the more you kind of throw at the under eye, as long as it's not causing irritation, is going to be beneficial. Now let's pivot to procedures you can do in the office, because what I've found in my practice is that skincare is really there to help maintain and support the under eye and lead to minor changes. But if you want to see major, significant changes in your under eyes, you usually need to introduce some kind of procedure. And whenever I talk about in-office procedures, I always want to be abundantly clear. This is such a personal choice. I never want people to feel pressure to anti-age or to have procedures done. These videos are really here just to educate those who are interested in that. So a really quick thing you can do in the office that tends to work quite well is to pop 1 or 2 units of Botox right under the eye skin. What we're really doing when we put Botox under the eyes is targeting the very superficial musculature there that's always a little bit contracted. So it's not there for the deep crow's feet. You can put Botox around the eyes for that, but just for that tiny rippling that you start to see. And that's not going to work for everyone, nor will anything I talk about. Cosmetic procedures are not 100% effective in everyone they are used on, but it's things to think about trying. So think about when you smize or smile with your eyes. You do a little bit of squinting, and that can repeatedly contract that under eye skin. When you get Botox there, it can soften the intensity of your smize. So again, that's do you want that or do you not? But that can help make that skin more smooth. Another really popular under eye treatment is using PRP or PRF. That stands for platelet-rich plasma or platelet-rich fibrin injections. PRP or PRF is really relying on the body's own regenerative properties, and that's because it comes from your body. We draw your blood, we spin it really fast in the office in a little machine that separates your red blood cells from all the growth factors and nutrients that float around in your blood. That is called your platelet-rich plasma or platelet-rich fibrin. We can then take that and inject it into the skin under the eyes to improve the quality of the skin there. And I always want to be clear with under eye injections of PRP or PRF, we're not really using it to volumize the area. It doesn't help with hollowness. It really helps with dark circles and improving the quality of the skin there. The reason I'm such a fan of PRP and why I think it's so popular in my practice is 1, patients see really good results, but 2, using the body's own regenerative properties are becoming a huge thing in cosmetics. And sometimes people are nervous about Botox or they don't want to put filler under their eyes, which I totally understand and often recommend against. And so using something like PRP or PRF is a really nice alternative. I'll talk about this a little more when I get into the other procedures, but when it comes to resurfacing the under eye area or treating the under eye area with any in-office procedure, it often needs to be done multiple times. So when it comes to something like PRP, for example, people are often doing it at monthly intervals for 3 sessions and then kind of taking a break and seeing how their skin responds. Aside from things like Botox and PRP, resurfacing procedures are really a great way to see improvement in the quality of the skin under the eyes. So I'm talking about lasers, chemical peels, and microneedling. Now you don't need to do all 3 of these, but lasers, microneedling, and chemical peels all essentially work in the same way. They are creating controlled damage of the skin and then allowing the skin to build itself back in a stronger, healthier way. CO2 lasers, which are ablative lasers, meaning that they're actually vaporizing columns of tissue when you apply them to the skin, I would say are the most powerful things we can do to resurface the under eye area. And when I'm doing a CO2 laser around my patient's eyes, I'm generally not doing it with the expectation of doing repeated sessions. That's sort of like a one and done, and then you're good for many years. However, CO2 does come with a lot of risks, and it's not ideal for people with deeper skin tones. So for those who cannot tolerate that under the eyes, or they're nervous about the downtime, or they're just not a good candidate, using other gentler resurfacing methods like a light chemical peel, or in my practice, much more commonly, we're using microneedling under the eye to stimulate collagen, is a great way to approach that. Microneedling is particularly good for delicate skin, so I use it a lot on people's necks, I use it a lot under the eyes. I do it full face, of course, but those areas tend to respond better to microneedling than to a lot of other interventions. And again, you need multiple treatments, and we're not going super deep because remember that skin is not thick, so we don't need those microneedles penetrating super deep, but you do need to repeat that to get that collagen firming and actually see results. I think of microneedling as just like true mechanical trauma of going through the skin. There's also something called radiofrequency microneedling, so maybe you've heard of Potenza or Morpheus, and that's when the microneedles are essentially heated, so you're not just getting the true trauma, but you're also getting heating of the tissue, so it's more effective. But when you're doing that in the under eye area, you need to be so careful and be under the care of someone who really knows what they're doing, because we don't want those needles penetrating too deeply and heating the fat under the eyes, because that can cause destruction of the fat and make you look more hollow. So if I'm doing radiofrequency microneedling for someone's under eyes, I'm going so shallow. We are staying at a depth of 0.5 millimeter or less. Another question I often get asked is whether or not biostimulatory injectables, things that stimulate collagen and elastin like Sculptra or Radiesse, can be used under the eyes. And generally, no, we don't use those under the eyes. We don't use them near what we call sphincteric muscles, so muscles that contract in a circular motion, so not around the mouth or around the eyes, because you're at a higher risk of that product creating a nodule. And these types of products are not reversible, so if you were to get a nodule there, it could be a lot more problematic. So that covers a lot of things that you could do relatively non-invasively in a dermatology clinic, for example. But I do want to spend a second to talk about plastic surgery for the under eyes as well. Oftentimes I find in a cosmetic consultation when someone is bothered by the under eyes, it's not just the crepey skin, it's also the dark circle, or it's also the eye bag. And so if we were to just tackle their crepey skin in the office, they may not be fully satisfied. And that's where surgery really comes in. It's called a lower blepharoplasty, and it involves kind of replacing or displacing things that have kind of moved into the wrong areas as you've aged. And if you want a comprehensive under eye rejuvenation, surgery is almost always part of that conversation. It's not to say the more superficial things to improve the skin quality won't be helpful, but you just have to understand that there might be things that still bother you about your under eye even after you undergo those procedures. But overall, do not be discouraged about your under eyes. 1, it's a really normal part of aging. 2, you care about and notice your under eyes way more than anyone else does. And 3, there are things you can do about it if it bothers you. Do you guys have any tips to add or products to recommend when it comes to the under eyes? Definitely let us know in the comments. Don't forget to subscribe to the video and like it as well. Thank you so much for being here, and I'll see you next time.